We've onboarded 134 employers in 2024, some of the largest employers in the country. I'm Mark Clermont, CEO of Cecelia Health. Our moonshot is to help patients gain access to specialty medicine. We do that through telemedicine. We make it accessible, whether you're in a rural setting, an urban setting, anywhere. Not only are we providing access, improving access for patients, how they get access. We're leveraging channel partners like pharmacy benefit managers. We work with the largest pharmacy benefit manager in the world to bring our services to downstream self-insured employers, health plans, etc. I'm excited about that because channel partners can help reduce friction. And we reduce friction because we don't insist on having Cecelia Health's name in lights. We'll operate in that PBM's name, we'll operate in our other channel partners' names. And so it has this spidering effect. I could not be more excited for how patients find us, whether that's through their insurer, their PBM, their pharmacy, their employer, you name it. That's the name of that's our moonshot in a nutshell. We've had incredible growth these last several years, and a lot of that is driven out of this thing we call interdisciplinary specialty care. You maybe have heard of us as virtual specialty care, and you think about, I liken it, the analog is to direct primary care. So everybody understands what direct primary care is. It's virtual in nature. Not so familiar with virtual specialty care, but that's exactly what it is. And then when you start adding in, because there's specialties in medicine, you start thinking about those adding in multiple specialties, but it's more than just being multidisciplinary. It's important that they all work together. And as we're working together, that's where the interdisciplinary aspect comes together. And then we're focused only on chronic diseases. So you have this thing where we've integrated GLP-1s into our practice, not as a GLP-1 company per se, but as a company that also happens to have GLP-1s as part of our book of things to practice medicine. And at the end of the day, that's the thing that's exploding. Employers, we've onboarded 134 employers in 2024. 134, some of the largest employers in the country. And what they're looking for is to provide some GLP-1 access for their employees and their dependents, but they really care about appropriateness. And so you don't want people going on, off drug therapy. And in fact, if they come on drug therapy and they're having success with the health coaching and the lifestyle wrapper that goes with it, let's start thinking about step down onto something certainly less expensive, but maybe just as effective as the health coaching aspects of a patient's care is progressing. That's what I'm excited about, because what it's doing is producing reduced cost of care, and that's both reducing therapeutic utilization, so drug utilization reduces. It's reducing medical expenditures as well, so we're reducing cost of care. Clinical outcomes are actually improving because patients are getting appropriate care with real physician oversight. They're working and talking with real physicians, real registered dietitians, respiratory therapists, and all of this is integrated. So unlike some shops that will have, I only do weight management, or I only do GLP-1 drugs for weight management plus diabetes. That's there and good for them. This is a rising tide of utilization. But at the same time, that's not the only thing. We have new indications for chronic kidney disease at the intersection of obesity. We have a new indication for sleep apnea. If you're interdisciplinary and your structures are built where you can add in, like we add in, now you have something that's dynamic. So now you're treating a patient not just for weight management or not just for diabetes or the intersection of that. What if you're limited? My competitors are limited. They can't do the other stuff. And so, but access to these drugs is high in demand. If you're a company like a DME company that runs a sleep apnea program with, say, CPAP devices into the home, they're coming. They're going to be prescribing GLP-1s. What do you do with that intersection? If you're looking to reduce cost of care, reduce patient confusion, as a patient, do I go see my sleep apnea DME company and my sleep specialist, or do I speak with the weight management person? Do I speak with the diabetes person? It's like we're revisiting this whole point solution problem all over again. It makes no sense. That's the founding principle of what this interdisciplinary specialty care is all about. That's what I'm excited about.